this web conference. Thanks for joining us. This is, I believe it's number 9 of our series, or 8, and we have 2 more for this year, or this one and 1 more for the year. Our last one for the year here is going to be in November, the last Tuesday in November, and that will be with Dr. Linda Chamberlain, who will be talking about trauma-informed approach to adverse childhood experiences and thinking about that piece as it relates to promoting resiliency, health, and safety and prevention. So we're really excited about that one, and that will be the last one of this year to kind of wrap up. But today we're really excited because many people have been helpful in thinking through this web conference series and this work. And so today is an opportunity to feature a small representation of the broader Pathways group. So this series was organized by a subcommittee, and part of that group is represented in sharing information today about the work we've been doing to address barriers to health and safety and consider them in our work. So I'm really excited to introduce several people that are participating in this today, one of them being, and they will talk more about themselves. We have Ann Roush from the Council on Domestic Violence and Sexual Assault. We have Timmy Tullis from the Association of Alaska School Boards. We have Rachel Muir, who is a long time from Dillingham but is now working with the University of Alaska Anchorage. And we have Gretchen Clark, who won't exactly be able to speak today as she doesn't have a voice, but has been helpful in a lot of this work. So did I remember everyone? And I guess to get us started off, we're going to have Rachel Muir start and talk a little bit about her involvement with Pathways and this work today.
Hi, this is Rachel.
I'm sorry. Yeah, go ahead, Rachel. Sorry.
And will you switch the slide there? I'm a nurse practitioner and have been a public health nurse for a long time also. And I have had personal experiences around the globe that kind of led me to the root cause interest. I was a Peace Corps volunteer in Lesotho, Southern Africa, and really that experience educated me on resource poverty and probably contributed to the reasons that I ended up in Alaska. I spent 10 years providing nursing care in a small bush hospital in rural Alaska, and the number and quantity of tragic events impacted me within the first weeks of being there. In 6 weeks, I think there were 4 or 5 very tragic events that in the community that I grew up in, one of those had happened in 20 years, and I was profoundly affected by thinking about how are people handling all of this. And I was noticing how it was affecting all the family systems, and everyone was related to the traumas, and I wondered how they were surviving. I worked at the hospital for several years and became a public health nurse, where the impact of all the historical trauma was so evident inside families and affecting childhood development. And my shelter received a Delta grant and said that intimate partner violence was preventable, and I was kind of hooked on figuring out how that is preventable, and that's how I got here.
Thanks, Rachel. So great. So next, Timmy.
Hi everyone, this is Timmy Tullis, and though I'm based out of Juneau, today I'm sitting in Sitka with Julia, and I just want to tell you a little bit about myself and how I got involved. I'm a longtime educator and someone that's always cared about individuals and helping people grow and change, and so when I was asked to become part of this committee, it just seemed like a natural fit. I was one of the original people that asked to sit on it because I think partially I was connected through my work to all 53 school districts in the state. But at the time that I began on this project, I was specifically working with all the boarding high schools in the state. And in those early days of this project, before the actual Pathways came into exist, when we just called ourselves Delta, I was working with all the staff that lived in the residence halls and the dorms with those students at the boarding schools. And it seemed like a natural fit to help them learn of ways they could help those individuals with prevention, and that it wasn't about reacting to situations, but it was helping those young adults see positive ways that their relationships could be. Since then, throughout my work, I've been able to help spread the word to the districts, and I will talk about that a little bit more later on. Thanks, Lori.
Great. Thanks, Timmy. So, Anne.
Sure. Well, hello, everyone, and thanks again for joining in this afternoon. My name is Anne Rausch, and I work for the Council on Domestic Violence and Sexual Assault. And before I shared a little bit about the Council and the work I do at the Council, I wanted to take a moment and share some of my personal involvement with this work. I'm a lifelong Alaskan. I was born in Fairbanks in the year of statehood, and my parents both came to Alaska separately in the early 50s, and both worked for the federal government. My father was a big game biologist and researcher, and his field of study was moose. And so for my brother and I, instead of dogs and cats for pets, we had baby moose, and spent much of our life growing up in the back of a pickup truck at research stations all across the interior. So really, it was really a beautiful and amazing childhood, yet complicated as well. Complicated because I was also a child growing up in domestic violence. And like many children who grow up in families with domestic violence, I represented on the outside and to the community a member of a happy and functional family, while on the inside I lived with the fear and unpredictability of a violent home. At the time in the state, there were no laws responding to domestic violence or sexual assault, and so I'm glad to have lived through that time to see the great changes that have been made. So really, originally, I came to this work seeking justice for myself and for my family. But as I worked in the field, I found a home for my passion for social justice work, and that belief grew along with my commitment and knowing that violence is a learned behavior, and therefore my hope rests with prevention and changing the social norms and circumstances that allow us to grow, that allow violence to grow. My current role is as a program coordinator with the Council on Domestic Violence and Sexual Assault. Now, the Council really was established in 1981, and it was placed in the Department of Public Safety intentionally, or I should say the placement within the Department of Public Safety was intentional, because it was strongly felt that domestic violence and sexual assault are primarily issues of safety, and that they must be acknowledged for the serious crimes that they are. The responsibilities of the Council are laid out in statute, and overall our mission is really to provide safety for Alaskans who are victimized or impacted by domestic violence or sexual assault by providing the state with a system of crisis intervention programs, perpetrator accountability programs, and prevention services. My current role at the Council is to oversee prevention funding that comes into our base budget, as well as to oversee programs that receive funding through the Governor's Initiative within that's kind of started up in the state within the last 5 years. Now, the Pathway Steering Committee, and the resulting statewide pathways plan that I'm going to talk a little bit about in a moment is, a critical part of my work with the Council, and the goals of the committee and the plan are critical to the success of growing prevention across the state. I've been a part of the Pathways Committee since 2010. So what we set out to do is, for a little bit of history, the development of the Pathways Plan began in 2003 when the Alaska Network on Domestic Violence and Sexual Assault, and I should say that the network is different than the Council. I always like to say that the network gave birth to the Council. The network is the private nonprofit coalition of all victim service programs in the state. So the network entered into a cooperative agreement with the Centers for Disease Control and Prevention to build capacity to prevent domestic violence throughout the state. The cooperative agreement is called DELTA, Domestic Violence Prevention Enhancement and Leadership Through Alliances. Wow, it's a huge mouthful, which is why we changed the name to Pathways, because none of us could ever remember the whole title. But what DELTA did do, it led to the development of a statewide steering committee, which all of us serve on, which first convened in 2005. And the goal of the committee was really to develop a coordinated way and a comprehensive way to work towards the prevention of domestic violence in Alaska. And so the resulting plan represents the voices of many Alaskans from diverse professions, regions, and cultures, experiences, and establishes a framework to organize and coordinate prevention and promotion efforts across the state. The plan identifies 7 pathways or strategies to address domestic violence and sexual assault. And I should say that even though Delta started out as a plan really looking at domestic violence prevention and reduction, through time really incorporated prevention and education along with the plan. So really the two are merging together. And many of the early risk factors associated with sexual violence, also there's a connection between the two. So much of this work and many of these pathways are intended to address both. But as you see up on your screen, there are 7 pathways. And I'll just kind of read over them. Establish a statewide infrastructure to coordinate prevention efforts, and certainly the Pathway Steering Committee establishes that. Also, there are other committees that work together and collaboratively to think through prevention efforts, what's happening at the state level. For example, I oversee a state agency prevention work group to really kind of harness the work of prevention in state government so that we're not, so that we can be combined in our efforts and we're not doubling up our efforts or doing different things and sharing information. It's one of the things, if any of you out there work in state government, you know we have a very siloed approach to our work. And so by giving ourselves opportunities to break through those silos and work more cooperatively has really been a help in planning for prevention programming in the state. We also, and then my screen just went down, so I'll read off that youth are leaders in primary prevention as another strategy of the Pathways Plan, and we have some wonderful examples of youth leadership, including the Lead On Summit for Youth that is held annually this year in Anchorage, and along with the opportunities for youth leadership and promoting peace in their communities, there are many projects that go along with youth involvement in that program. We also, as part of a strategy, really wanted to look at education, and so we wanted to promote prevention curricula that are integrated into public schools in grade K through 12. And so one of the curriculums that we're working on right now is the 4th R curriculum, which is more for the 7th, 8th, and 9th grades, but is showing promise in the reduction of teen dating violence. We also wanted to combine data so it wasn't so hard to find on domestic violence and standardize the data that was out there. The Council and the University of Alaska Anchorage has worked on the Alaska Victimization Survey. There's many, many other examples, but really coordinating this so that people could find the information. We're also working on media sources and making sure that they're partners in promoting respect and healthy relationships. And we're also really trying to engage communities in prevention work. And there are a number of different projects occurring right now to kind of bring all of these strategies that are part of the prevention plan or the Pathways Prevention Plan forward. And of course, one of the strategies that seeks to address the root causes of domestic violence and sexual assault is what the barriers to health and safety kind of webinars have all been about. You know, our desire, collective desire, to bring education and discussion forward on the root causes of violence really was the inspiration for the web series. And so far, these web series discussions have included information on racism, poverty, gender, and historical oppression. As a Pathways group, we've recognized and continue to work on the root causes of violence. We recognize that preventing violence doesn't just rest with the individual, but that we also have to address issues of social injustice like racism, sexism, poverty, and homophobia, and really all systems that support power over patterns in relationships rather than practices of equality and respect and power with versus power over models. So that's a little bit about myself as well as the history of Pathways, the Pathways Steering Committee, and what the Pathways Plan actually looks like, the 7 components, and what led us to the development and identifying the need for a webinar series on the barriers to health and safety. And I think I will turn it over to Rachel, and we'll have questions at the end.
Great. And right before you do, just to say on that slide that's up there, there's a link to the ANDVSA website that has all the recordings for the past web conferences if anyone missed them. So, thanks. On to you,
This
Rachel.
is Rachel. And public health nurses get to provide well child care for children in rural Alaska. And while I was in Dillingham, I had the opportunity to fly to many villages and provide thousands of well child exams. And in that exam, a public health nurse or a physician or nurse practitioner assesses physical health, provides vaccine, assesses development, and provides anticipatory guidance around development. In my role, I noticed that we were not seeing vaccine-preventable disease that much, but I was referring many children to early childhood services for speech, social, sometimes fine and gross motor delays. And what I noticed about those visits and referrals was the attachment of the child, either an anxious or an avoidant attachment between the primary caregiver, usually the mother with an infant and toddler, when there was violence in the home. It became apparent to me that the mother's stress response, safety, and trust when living in a violent home was affecting the developmental trajectory of the child. And that attachment system modulates the stress response for the infant. And when there's conflict or violence in the home, children without a safe and secure attachment develop some conflict within themselves. They want to move in to find comfort and safety, but when there's been inconsistency and violence, the fight or flight response kicks in for them, and they're unable to resolve that conflict within themselves, and they don't have any way to emotionally regulate. The self-regulation pattern is carried then into relationships in the future, in the community, in schools, work, and intimacy, and somewhat multi-generationally. Violence and addiction in the home often surface, and I felt like our work should be looking at supporting safety around the home, in the community, to prevent the epidemic of developmentally unprepared kids arriving at school, and then sometimes they get oppressed in the school due to their inability to self-regulate, and they were so affected by the violence they had witnessed that at times I was giving vaccines, and after a vaccine was given, a child would be upset but would cling to my warmth instead of their mother's if they had been in a violent home or in a situation where they didn't have safety there. So they were literally clinging to me, and then I also saw some children that didn't cry after a vaccine, and those kids profoundly affected me because my attention for them was appreciated or positive, and they weren't affected by the pain of the vaccine. So I felt compelled to figure out how to create safety for them and their development. In Dillingham and through our community assessment process, we looked at health indicators like unintentional injury, death, and incarceration rates of Indigenous people, and thought that they could be related to these developmental trajectories of growing up in an unsafe or oppressed environment where there's a history of multi-generational oppression from racism or sexism. And I met someone at our local shelter. Let's go to the next slide. So I think that's not it. How about the next slide, Lori? So the Delta Project, the mission of the Delta Project is, I think we're too far, is be a catalyst for creating empowered, transformed individuals, partnerships, communities, and societies committed to respectful, collaborative processes that promote a lasting legacy of equality, peace, and social justice. And I just kept that on my wall so that I could see if I was doing my job every day by empowering people in a respectful, collaborative way. And the Pathways Statewide Steering Committee developed these 7 goals, exploring the roots of violence. And I think we worked on the other 6 goals for several years, and then in our discussions, research, and experience, we agreed that our guiding principle in violence prevention is changing parity and lifting oppression across the socio-ecological model. We felt a little daunted by world peace for a little group of people, and we decided to develop the webinars as an opportunity to invite experts to engage the population in a discussion around the roots of violence and opening the dialogue statewide on the barriers of poverty, historical trauma, oppression, and all the isms that drove us to create a webinar series and explore these roots, and ultimately create change in conditions for the most powerless by empowering communities. I think that's, I'll turn it over now, right?
Oh, are these the pictures of the dialogues that you were talking about?
Oh yeah, okay, they're next, huh? Sorry
Okay.
about that, Lori.
That's okay. I think maybe we wanted to see how many people, there's a poll up there now, to see how many people have actually had a chance to participate in any of the web conference series. And so can folks see the poll on their screen?
I can.
And, yeah, and if you can, maybe you can just click on one of those. You should be able to click on one of those if you've been to any of those web conferences. So I see some people are responding. So,
Lori, can you maybe verify who led each one?
Sure. So that
Knowing Who You Are one?
Sure. The first one was the Undoing Racism, but it was Cheryl Oft and Michelle DeWitt from the Bethel region from the Association of Village Council Presidents and Tundra Women's Coalition. Then there was Dr. Donna Beagle talking about communication across barriers and intergenerational poverty. And then there was the Alaska Native Discussions on Racial Equity by First Alaskans Institute. There was Knowing Who You Are that was represented by IPWA workers and OCS. And then there was Paul Kivel that talked about social justice and prevention and violence. And then there was Deconstructing Gender by B. Cole. And earlier on, it's not recorded, but there was a Determinants of Health conversation by the CDC. So it looks like I'm going to close. If anyone wants to put their last numbers in there, oh, I see some numbers keep going up. I'm going to close the poll here. So I know everyone may not have had a chance to respond, but you should be able to see. So it looks like folks were able to join a lot of different calls, over 50 to 60% on most of them. So great, good. So I think, Rachel, that's what I have next on the slide is.
In my community, I think the work, the tribal agency was instrumental in opening dialogues, and it was rewarding to stand with them. The first dialogue that they created was the Annie E. Casey Foundation program called Knowing Who You Are, and it created a safe environment to discuss judgment, prejudice, racism, and how that collectively leads to institutionalized racism. The participants were people that had come and gone from Dillingham in professional roles, and then people that were born there also. And we had several courageous conversations. The discussions were in the context of fostering children, cultural humility, and one's own journey and growth around diversity. And another opportunity that the tribe offered was the community was an Undoing Racism dialogue, which explored privilege, colonialism, and how it's impacted social norms and cultures. It empowered agencies to change policy, to provide more access and less barriers to vulnerable people as they were able with funding constraints, and it also explored those constraints. Another training which was brought together people to talk about what's happened in their family histories and how they were going to proceed without being pulled into shame and pain around family traumas, was the Maria Yellowhorse Braveheart Historical Trauma Train the Trainer training.
I'm going to do it at a conference.
This level and depth of honesty of dialogue brought a healing and transformational moments, and it lifted shame, lifted despair, and empowered people to find voice and plan for a personal journey into wellness. Now my role at UAA Community Health Nursing faculty, I've noticed and appreciated the intentional work here through the Center for Faculty Excellence and the development of a difficult dialogues workshop to create space for the same discussions around equity in the university setting.
Thanks, Rachel.
I've been touching base with the teachers.
So, so as we're transitioning and Rachel's sharing about what those conversations look like in their community, Timmy, I think you wanted to do a little sharing about some of the work we've done around intersecting identities. Also, before we start, I hear some background noise, so if anyone's talking and there's background noise, if you could put yourself on mute for now, that'd be great.
Absolutely.
And Lori, the way you can do that, you can also hit *6 on your phones, and that'll mute phones as well.
I did not know.
Yeah, so there's folks that are talking. Thanks.
Thanks. So one of the things that we thought we'd like to do during today's session was kind of demonstrate an activity that can be very easily replicated in your work environment, or if you're an advisor to a group, or something to do with any time that you bring people together that you want to start some discussion. And so what I'd like everybody to do is just grab a little pencil or paper if you have a scrap piece of paper around you, and just for a minute or so, jot down a few ways that you would identify yourself. And for example, I'm going to give you how I may identify myself. And some of the things I might use would be that I'm a wife, I'm a female, I am middle class, I'm educated, I'm an international traveler, and I'm a motorcycle rider. So those are some things that I like to say are part of who I am and ways that I identify myself. So if I had some music, I would put it on. But if we can just take a little bit of time, and you don't want me to sing, if we could just take a little time if you're by yourself or if you're with a group, just jot down some of the things that you would use to specifically identify yourself. And just for about a minute. And maybe not even that long. All right, so as you'll see on the screen, we have put an open thing in there that if people just want to, if you're in a multi-group, if you want to have several people, just say some of the ways that you're describing yourself, and if you're by yourself, please add some of them so that we can get a sense and a list of some of the identities that people would use when they're describing themselves. So please take some time to enter those. Don't be shy.
So they can just type it right in the box, right? And with a comma, yeah. And so we won't be able to see who it belongs to. We just get a list.
Correct.
So everyone will just...
Great to see some of these coming up on the right-hand side of the screen.
Some we do know who they are.
Some of them.
Okay, should we, anyone else want to put, yep, there's a couple.
So as they're coming in, there's a next piece to this activity. And what I want us to think about now is that with some of these identities comes some power and privilege. And sometimes it's good to reflect on how that privilege has helped you succeed within a system or helped give you some power within a system. And I just thought that it would be nice if some people would be willing to share if they have a story or an incident where their identity has helped them have power in a specific situation which otherwise they may not have had, but it was simply based on one of their identities. So if anyone would like to take that opportunity to describe something and maybe get the ball rolling, that would be great.
And Timmy, I'm seeing for some reason it will not display the results, so I might just put them in the bar, the chat.
Oh, sure, Lori, whatever you need to do. That would be great, and then people could see them there. Maybe it's only the facilitators that can see them. That's why I can't.
I'm just gonna share them though. I'll type them in as you're talking, okay?
Okay. So does anyone want to take a lead and talk about how one of their identities has led them to have some power in a situation or within a system?
Timmy, this is Mark in Juneau.
Oh, thanks, Mark.
Hey, I'm here with Leona Santiago, and she'd like to share.
Sure. Oh, thank you.
Yeah, my name is Leona Santiago, and I'm a Native woman.
And has there been an identity that you had that gave you some specific power, Leona?
I believe being Native. I probably want to share this story about where I was kind of probably seeing or identifying domestic violence at age 15. I was a foster child most of my life, and I got to go home and be with my mom and dad for a year. And my mother was really abused. And I witnessed my dad beating my mother, and she was pregnant. And I may have saw that as a baby, but I don't remember. But I hadn't seen violence in the home I grew up in. And it was kind of shocking to me. But as an adult, as I got into adult life, I realized that domestic violence was something I really would really like to work hard in, and I got involved with it in Seattle, Washington. And I had to get out of an abused relationship to empower myself, and I start doing domestic violence work in Seattle and worked with the Native community. There was a grant available, and I was supposed to be just an educational, but as Native people, it didn't turn into an educational thing. It turned into where my home became a shelter for Native women where they could hide out. And anyway, I just wanted to share that because that was like in the early 80s. And women were abused and needed a home for 2-3 days, and I had my home open. I did educate them to let them know, that they didn't have to be in the relationship. And I moved to Alaska and had been down in Seattle for a powwow, and this one lady came up to me that had stayed at my home, and she said, "I just want you to know that I'm fine. I really appreciate what you did for me." And it just almost made me cry because, she was really scared and really feared for her life. And it was really enlightening to know that I didn't know much about domestic violence, but I did what I could, and I ended up, being a safe home in Seattle for a lot of Native women. And I had to shelter one of my best friends who now lives in Alaska, and she thanked me after 30 years for what I did for her. So I just wanted to share that.
Well, thank you. And I think that being able to use being Native in a way to help create a safe environment for others who may have not been as trusting maybe of a Caucasian culture were able to find trust in you, and you were able to use that. So thank you for all your work.
Thank you.
Anyone else have anything where one of their identities has helped them with some privilege in society?
This is Julia in Sitka. I have an example of something from my childhood. I grew up in the inner city of Toledo, Ohio, and I went to one elementary school for a couple of years, and it was a school where teachers were allowed to paddle. students whenever they felt like it. And my sister was in kindergarten and was paddled for something. She was unfairly punished for something she didn't do. And my parents went to the school board, and we knew the president of the school board. We went to the same church, so we were pretty good friends with them. And I came from a two-parent home and educated middle class, and we were granted an out-of-district pass to go to a different elementary school, a better elementary school where teachers were not paddling students, and that kind of thing just wasn't happening on a daily basis. So I think sometimes had we not been middle class, educated, or didn't have the connection with a school board president, that we wouldn't have been granted that pass. We would have been perceived to have, I don't know, maybe the school board would have thought my sister had actually done something to deserve that punishment, and we wouldn't have been able to transfer out of district and remain at that school for the rest of our elementary school days. And all of my siblings went to that elementary school for years to come.
Thank you. Thank you so much, Julia. I think that that's a good example as well as how something that maybe was out of your control, the fact that you were a Caucasian person in an inner city, but you were able to use your whiteness or whatever that might have been in your family's role in society to get transferred to somewhere that was a better or perceived to be better school, and not everyone would have had that privilege. So again, I'm sure everyone has a story that they could share about how privilege has helped in their system, and this is, again, just an activity that you could replicate in one of your work environments or when working with groups to get the discussion going about privilege and our identities and how they are interlocked and make a difference in how we walk through the world that we walk in. Any other thoughts or comments before we move on? All right. Well, thank you, everyone, for participating in that. I appreciate it a lot. So it's still Timmy, and I was just going to talk about one more thing. And as I mentioned earlier, I work with all 53 school districts in the state, and I oftentimes, and specifically I work with the school board members who are the ones that are oftentimes making decisions. And so since I've been part of this committee, I've always tried to think of ways that we could get information in front of my board members. And I know one year Lori Grass-Green was able to come in and present about the 4th hour curriculum so that board members could become more aware of that. And in the past, coming up, I have people that are on the committee that will be attending our annual conference and sharing more information with our school board members. But specifically because of this webinar series, I learned about the Andori Project, which is the Alaska Native Dialogue on Racial Equity Project. And I had not really learned or heard too much about it before, but when I listened to the webinar, and ironically I didn't attend it live, I listened to it once it was posted up on the website, I thought that what a great opportunity for my school board members if there was a way that they could potentially learn a little bit more about the Andori Project. So I called Jory, and she is the woman sitting down at the table in this photo, and asked her if she might be able to present to my group when we were in Anchorage in the fall. And I had about 80 school board members and superintendents coming into Anchorage. And she jumped at the opportunity and asked Liz Medicine Crow, who is standing speaking in this photo, if they would come and, or that they would come and do a session with my individual board members. And after they did their hour-and-a-half training, I would have to say it was one of the most positive trainings that my board members have ever received. The comments were unbelievable, and many of them, in turn, wanted to invite Jory and Liz to come to their school districts to do this conversation. They walked us through the whole presentation. They had our group participate just as they had done when they went into communities and have a dialogue sitting in tables. We developed answers and we hung them on the wall around the room about how we could improve communications in our schools and what are some things that might help our districts move forward and be more equitable around race. And so it's obvious that my district members loved the session, And it all happened because I went back and listened to one of the webinars that this group had presented. And so I just wanted to say directly how this has affected my work. Even though I'm part of the committee, it also has had a positive effect on the people that I work with. So I just thought I'd share that, and I don't know if anyone else has a direct story that they'd like to share about how it happened or anything that they tied up with their work.
Well, this is Anne, and you know, one of the things that that I work on at the council is organizing an annual prevention summit. And being part of this committee, and also, you know, I really am intentional about bringing topics that are barriers to health and safety forward when communities come to the Prevention Summit. The Prevention Summit, for those that don't know, is an opportunity for community groups to come together and do planning and strategizing around prevention programming in their local area. And you know, sometimes it's not easy to forget, but thinking through barriers to health and safety, thinking through the isms, and making accessible prevention work to marginalized groups is something that's really critical in successful prevention planning. And so every year we try to bring in workshops that address racism or gender or healthy sexuality, and we're doing that again this year. And the Andori Project is also coming to the Prevention Summit. So people, as they're building their plans and building their thoughts around prevention, also have to take into consideration some critical issues around the root causes of violence. So that's just an example of one way to bring that into work and planning.
Great. So, Rachel, did you want to share about undoing racism outcomes?
Just share for a couple minutes. You know, after we had our Undoing Racism workshop in Dillingham, a group of people who participated really decided to focus on one event or one problem, and it was safety around a school district and a Head Start where the traffic was moving too fast, and they felt like had that school district been in a city where there might have been more people of privilege, that the speed of the traffic may have been slower or the safety enhancements may have been greater. And so they really felt empowered about creating safety for their kids around that, and gathered and were empowered and are working on that project right now together. And that's something that came out of our planning. And it might not seem like it really relates exactly to violence at home, but I think when anyone is empowered, then around safety and safety of their children, I think that has large effects in the home also.
Thanks, Rachel. So this next part was going to be done by Gretchen Clark, who is on the phone but does not have a voice. So I'm going to do the best I can in her absence here to share a little bit. Part of what we have been doing is just to kind of reflect too on how the work of the Pathways Committee has taken shape and how that has translated into bringing these web conferences together and really highlighting a lot of great work that's happening already in the state. And you know, the other piece, besides creating space for these conversations as a statewide group, the other conversation was really what does it look like to address these barriers to health and safety? And another important component to that was thinking about it more holistically. And I have this slide up there that says, you know, when we're looking at barriers to health and safety, that we may be looking at norms and values and policies and institutional practices and the way that culture, whether that means a particular culture or that that word culture can mean a lot of things about specific communities, and kind of looking at that together. And what we decided as the Pathways Statewide Steering Committee was that it kind of needs to start at home, you know, here with us. And so we as a Pathways group have been trying to figure out and saying, okay, well, what would it look like to be having these conversations in systematic ways, and what tools could help us to further that conversation so that within our own organizations, or as we're doing planning around prevention, as we're doing the work that we normally do, how can we have some tools and have some lenses and frameworks to think through the work we're doing, how we're doing it, and figuring out how that is reducing those barriers to safety and reducing those barriers to health kind of more holistically. And so, we've spent some time as a subcommittee thinking through, what could this tool look like, and kind of brainstorming what those pieces could be. And on this next slide here, this was just some of the pieces that we started discussing. And to back up just a minute, I think during this process what we did was we looked nationally and looked at health equity tools and racial equity tools, and looking at different tools that have been suggested to use within agency for agencies to really think about what does it look like in their agencies and when they're developing programs, and what does their practice look like, and how does that practice maybe create, intentionally or unintentionally, create some barriers. So I have on this next slide here just some of the core pieces for the tools that we're developing is making sure that people are looking at what training is available for their staff, what conversations are happening within their organization, tools that will maybe help people reflect on what their organizational policy and protocols are, and thinking about how they provide service and prevention and plan, and doing that in a way that makes sense for a variety of identities and communities, so that we create more access to health and safety, and also for that to be a part of how we assess our success. So we don't have we're not sharing all the details yet. That's probably to come next year, but we wanted to put out there that we're working on this tool, and for folks that are interested in being more involved in the development of this tool, or interested in having those conversations, that to get in touch with someone on the Pathways Statewide Steering Committee or myself, and to be more involved in that. And we know for some people that might be like maybe using it as an assessment, and for some folks that may be about how they have conversations in all of their meetings to include the various topics. So I just wanted to put out broadly, and wanted to see if there was anyone else on the Pathways group that wanted to add anything about the tool specifically. Okay, so that was kind of our overview of just what the Pathways work looks like around addressing barriers to health and safety, looking at root causes and how we're doing this work. I wanted to open it up for the next few minutes to see if folks have questions for any of the speakers, or want to talk more about next steps. You can either type your questions in the chat, or you can just unmute yourself and ask directly. Any questions out there? Well, while you're thinking about a question, I have a question for all of you. Oh, I missed a W there, but bear with me. So the last question that we have for you all is, it looks like a lot of you have participated in many of the web conferences, and you've heard stories about having these conversations, and maybe some of you have had those conversations in your communities. So what we'd like to hear from you all is what ideas do you have about how to bring this back to your own work or agencies. I see it got cut off there. So what ideas do you have about how you can bring back this root cause work to your own agencies or your own work? And you can just type your responses right in there. Or you can share it verbally if you want. Just take a moment to think. So I'm going to just share some of these. So someone said, does anyone want to share their answer? Is anyone willing to? So some folks wrote that they're thinking about at a grant planning meeting to bring some of these conversations there, and in a cafe setting that they're planning on having. Some folks asked if there's access to the individual presentation PowerPoints to share. Some folks are thinking about looking at their own agency infrastructure and really thinking about how it's serving or not serving folks. Any other ideas?
I would like to have the Andori folks come in and do a presentation in my office.
Okay. Great. Any other folks have ideas? Those of you that are meeting in a group, have you all been chatting there about your ideas? So it looks like some more answers here. People are working towards incorporating their conversations into their local pathways work, I think, and they want to integrate it into medical, home, and community social agency services. Any other thoughts or questions?
This is Sherry and Kenai. I think, I heard another community doing this, and I'm not quite sure which community, when I was at a network meeting not long ago, but they take the opportunity to invite some of their community partners to be a part of these webinars that are going on.
Right.
And kind of have like a little lunch meeting, and then afterwards discuss it, and then get those community partners to also participate in spreading the information out so that people are owning this, which I thought was a really good idea, and I think that I'm going to steal that idea.
Cool.
It's one thing to think of things, how we're going to get this information out, but when you're bringing people in to be a part of it, the ideas generate much more freely.
It's a really good point. And maybe someone from the Juno group, I know right now they're meeting in a group, maybe someone from that group can share how that's, well, I think we're running out of time here, but Sherry, maybe I can connect you with folks that are doing that. So.
I think it was Sarah Lynn maybe that was talking about how they do that. So just to bring that up, though, I thought it was a great idea.
Cool. Well, I really want to thank everyone for joining once again, for tuning into a lot of these calls. They will be recorded if you feel like this is something that we should share. And I want to thank Anne and Rachel and Timmy and Gretchen for being mostly willing presenters on this call. And I'm looking for, you can go to the ANDVSA website and get all of these webinars that have been recorded and share them with your partners or listen to them together. So really thanks so much to everyone for calling in. So.
Thanks, everyone.
Thanks.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Please stand by.